Hi, I am Aurel Enriquez, and this presentation contains our discussion on our Week 3 topics for mycology. Here is the outline of our discussion. We'll first go through the causative agents of superficial mycosis, and then we'll proceed with the different types and different causative agents of cutaneous fungal infections. Let's begin with the causative agents of superficial mycosis. So when we say superficial mycosis, these are fungal infections that are confined only to the outermost layer of the skin, or sometimes this may involve the hair. Now, with regard to the layer of the skin, this only involves the stratum corneum, which could be found at the epidermis, or it's the topmost layer of the epidermis. So, di ba po yung skin natin? It's composed of the epidermis, and then below that is the dermis, and then the hypodermis or yung connective tissues. So sinasabi po dito, no, nandun sa epidermis, this is further divided into 5 different layers, and yung pinakataas is the stratum corneum. So when we say superficial mycosis, it's a type of infection that only involves or is confined sa topmost layer ng epidermis, which again is the stratum corneum. Now for this one, there would be no tissue response and no inflammatory reactions that we'll be able to observe. Kasi po, ayun nga, nasa surface pa lang talaga yung fungal infection or yung fungal growth, and it's not yet at a place kung saan this would be detected by the cells of our immune system. Okay, so ayun po, hindi pa nakakapag-react yung immune system natin, hindi pa ito makakapag-cause ng inflammatory reactions kasi nandun nga lang siya sa pinakaibabaw. Now, listed here are clinical manifestations depending on whether which part of the body is involved. So kung sa skin po, ito yung general observations na pwede nating makita or ma-observe. If it is affecting the hair shaft or hair strands, ayan po, we may be able to see cement-like attachments. But as we go through the different causative agents of superficial mycosis, makikita rin po natin, no, nag-iiba-iba rin yung specific na clinical manifestations nila. Let's now talk about the first causative agent of superficial mycosis on our list, and that would be Malassezia furfur. So Malassezia furfur, this is the causative agent of Tinea versicolor or Pityriasis versicolor. So for patients with Tinea versicolor, we may be able to observe patchy and scaling lesions. So kapag sinabi po natin na scaling, it means that there are areas of the skin that are flaking off or parang natutuklap sila. And when we say patchy, iba yung texture niya, tas iba rin po yung color niya compared to the normal skin texture and color of the uninfected sites of the patient. All right. Another term that we need to be familiar with is the term versicolor. So when we say versicolor, no, it actually means that there is varying pigmentation. All right, so we may be able to observe patches of varying pigmentation. This also varies, or this also depends, no, on the skin color or skin tone of the person. So kung halimbawa po maputi yung pasyente, then we may be able to observe tan or fawn-colored patches. So parang medyo mas dark daw po yung mga patch na ma-observe natin. Pero kung halimbawa yung pasyente naman po ay moreno or morena, then we may be able to observe lighter patches of skin. So, mas maputi daw po kesa dun sa normal color ng skin ng person. Okay, so yun po, that's what we mean when we say there is a varying pigmentation. Nag-iiba yung itsura niya from person to person. And ayun nga po, that's also kind of like where the term, or what the term versicolor would mean. Now, this is more evident during warm months or if the person is constantly exposed to the sun. And the common sites of infection would include the face, chest, trunks, and abdomen. Well, of course, hindi naman po confined lang sa mga areas na yun yung infection. We may also be able to observe infected sites dun sa arms or lower limbs ng patient. It's just that these are the commonly observed places. Now, Malassezia furfur, this is a common skin colonizer. So for some people out there, kasama sa normal flora nila ang Malassezia fur. And for some people out there, maliban sa Tinea versicolor, this could also cause dandruff. Alright, keep in mind, dandruff could be caused by many different things. Alright, so ayun po, for some people, this could be stress-induced. For some people, ayan nga po, it could be because of the overgrowth of Malassezia fur. Listed here are some risk factors. So ayan po, no, corticosteroid therapy, genetic influence, even poor nutrition and excessive sweating, which is linked to ayan nga po, having warm climates or constant sun exposure. All right, so ayan po. Now, hindi masyadong inexplain in a very detailed manner, no, dun sa reference book natin, kung anong direct connection nitong mga risk factors na to into developing the infection. But it was mentioned dun sa reference natin that it could be linked to the squamous cell turnover rates. Alright? Kung gaano daw po kabilis or kabagal yung turnover or pagpapalit ng mga squamous cells natin. So, anong nangyayari po, no? For people with slower squamous cell turnover rates, sila po yung mas prone to developing the infection. Kasi kapag mabagal mag-shed off or mabagal mapalitan, no, yung topmost layer ng epidermis natin, nabibigyan ito ng time, no, nabibigyan ito ng time yung Malassezia fur to continue to overgrow and eventually cause the infection, compared to people na normal or mas mabilis yung squamous cell turnover rates, hindi nabibigyan ng time yung pag-overgrow ng Malassezia fur kasi patuloy na nasi-shed yung topmost layer ng skin. So we constantly get rid of the fungi if it's present on that specific area. Okay, so again, these risk factors, no, have been linked to squamous cell turnover rates. Mas mabagal yung turnover ng squamous cells, mas prone to developing the infection ng Malassezia fur. Let's now look into the laboratory diagnosis of Malassezia fur. So for this one, the specimen of choice would be skin scrapings. So either with a blunt spatula or with a glass slide, no, you would start scraping off the infected area, tapos yung skin that would fall off or would flake off from the infected site, no, iko-collect po siya using a glass slide. So after that, we would proceed, no, with a KOH prep or the potassium hydroxide preparation. So with that, microscopically, we should be able to observe budding yeast cells with branching and septate hyphae. Okay, so makakita daw tayo ng maraming budding yeast cells, tapos marami ring branch septate hyphae. As we can see right here in figure B, okay, so in this photo, we're seeing, ayan po, no, there are clusters of budding yeast cells, and we're also seeing kind of like clumps of branched hyphae. Now, this has been given the name or description, no, that they kind of look like spaghetti and meatballs, all right? So may spaghetti and meatballs appearance daw po ang Malassezia fur. So yung clusters daw po nung budding yeast cells, yun yung meatballs, and then yung clumps nung branched hyphae, yun daw po yung spaghetti, all right? Kung sino man yung nagpangalan nitong description na to, gutom lang yan. Other methods for diagnosis would include exposing the patient's skin to the Woods lamp, as we can see right here in this figure. Okay, so in this figure po, no, we may be able to observe this this kind of like area with a dark background, tapos there are larger areas right here that have fluorescence. Okay, so yung mga dark areas po, yun yung normal and uninfected areas of the skin of the patient. Minsan po kasi for some people, hindi nakikita agad kung nasaan yung site of infection, okay? Maaaring hindi obvious agad kung nasaan yung site of infection. So, napapansin lang nila nakakaiba yung texture ng skin or there is mild itching, but they don't really see what's happening on there. So, ayun po, we need the help of a wood lamp. So after exposing the surface of the patient's skin with a wood lamp, we may be able to observe some fluorescence. And yung nakikita natin ditong sites or areas with fluorescence, yan po yung infected sites. Okay, so dyan yung preferred areas where we could collect samples. Another thing that we need to remember, if we would like to grow Malassezia fur in artificial culture media, it must be supplemented with olive oil. Okay, so it may be difficult to grow Malassezia fur in artificial or in routine culture media, if it is unsupplemented. So again, we need the supplementation of olive oil to maximize or to kind of like help with the growth of Malassezia fur. Let's now proceed to the next causative agent of superficial mycosis on our list, and that is Piedraia hortae. So Piedraia hortae, this causes black piedra. Okay, so black piedra, this is a fungal infection that would occur only on the hairs of the scalp. Okay, so hairs of the scalp lang po, pwede nating ma-observe itong infection na to. Lahat po ng sample source na makokollect natin suspected for black piedra would only be hair from the scalp. Okay, now with this infection, we may be able to observe hard brown or black gritty, magaspang na nodules that are attached to the hair shaft. So these ones are firmly attached to the hair shaft. So if for example, ito po yung hair shaft or hair strand ng patient, yung nakikita natin na attachment or yun nga mukhang nodule dito sa area na to, yan po yung nodules ng black piedra. So with regards to the diagnosis, we could collect clippings or cuttings of the hair kung saan natin nakikita yung mga nodules. So what would happen is we would place these hair cuttings at 10 to 20% KOH. So potassium hydroxide preparation po ulit yung pwede natin gawin. Now, the nodules could be crushed to reveal asci. So, pwede daw pong durugin, yung mga nodules para makita natin yung mga ascus or asci sa loob. And with that, we may be able to observe thick-walled rhomboid cells containing the ascospores. Alright, so let's look at these photos right here. Dito po sa figure A, this is another example of a hair strand with a nodule attached to it. Dito sa figure B, nakikita po natin yung ibang mga structures that could be observed. Dito sa figure C, this is what their colony morphology would look like on Saporod's dextrose agar. So on Saporod's dextrose agar, we may be able to observe brown colonies, all right? And then figure D shows us what the asci or ascus would look like. So again, nasa loob po niyan are ascospores, okay? So ayun po, nagko-correlate yung appearance ng nodule sa appearance ng ascus, very round and dark colored din siya, and nagko-correlate din siya sa appearance ng colony morphology ng Piedraia hortae, which is very brown or dark brown yung itsura. Let's now proceed with the trichosporin Bagelii complex. Now, in the past, they thought that the organism that causes this infection was just one organism, which is Trichosporin Bagelii. But after further studies were done, they were able to find out that this infection is actually caused by multiple different species. Okay? Kaya po siya tinawag na complex. Alright? So, under this complex are multiple different species. Now, sa mga susunod na discussions natin, marami pa tayong may encounter na mga species na tinatawag na siya ngayon as a complex. And yun po yung ibig sabihin natin. It's kind of like a list of similar organisms, although they are different species, that is capable of causing the same type of infection. So the members of the Trichosporin Bagelii complex are the causative agents of white piedra. So listed here are the specific species under the Trichosporin Bagelii complex. Now, these four ones right here, Trichosporin ovoides, Inkin, asteroides, and cutaneotrichosporin cutaneum, sila po yung most commonly isolated or sila yung most commonly observed to cause white piedra. But the other species over here, no, are also capable of causing different types of infections, lalong-lalo na po kung immunocompromised or may comorbidity ang isang patient. So, we also have Trichosporin asahi, which could cause a fatal disease in the immunocompromised. So, for normal people, white piedra lang yung dinudulot nito, but if the person is immunocompromised, then this could cause a deadly disease. Next is Trichosporin mucoides. This has been observed to cause meningitis, no, fungal meningitis. And next is Apiotrichum mycotoxinovorans. So, ang Apiotrichum mycotoxinovorans naman po, this has been observed to cause a pulmonary disease in cystic fibrosis patients. Okay, so may existing disease na yung pasyente, meron siyang cystic fibrosis. And ayun nga po, it kind of like increases the risk of this person to acquire or to further have a pulmonary infection caused by Apiotrichum mycotoxinovorans. Okay? So ayun po, occasionally this is found as a normal flora. So again, there are people out there na kasama po ang Trichosporin Bagellii complex members sa normal flora nila. Now, tulad na nabanggit kanina, no, the Trichosporin Bagellii complex causes white piedra. So it occurs on the hairs of the scalp, face, and pubic regions. And for this one, we may be able to observe soft mycelial mats surrounding the hair. I-compare po natin yan with black piedra. With black piedra, the nodules are firmly attached to the hair strands and they're very dark in appearance. Pero kapag white piedra, no, they're lighter in color, as we can see right here in this photo right here, no, mas light yung itsura niya. And also, another point of comparison, no, against black piedra. Ang black piedra, hairs of the scalp lang ang pwedeng maapektuhan. Pero for white piedra, this could affect or cause infections, no, on the hairs of the scalp, the face. If, for example, the patient has a beard or a mustache, pwede rin po magdulot ng infection doon. And at the pubic regions or the pubic hairs. Okay, so yun po yung comparison between white piedra and black piedra. So kung halimbawa may nakikita po kayo ng mga pictures tapos nahihirapan pa rin kayong i-differentiate, no, kung ito ba ay black piedra or white piedra, you could read on the other details. So kung halimbawa, i-check nyo kung ano yung sample source, tapos yung sample source niya ay hindi galing sa scalp, then it's most likely white piedra. Because again, black piedra is confined to the hairs of the scalp. Moving on to laboratory diagnosis, members of the Trichosporin Bagellii complex, they all look similar. Okay, microscopically, magkakahawig or magkakamukha po yung pwede nating ma-observe ng mga structures mula sa Trichosporin Bagellii complex. So ulitin natin, lahat ng nasa listahan kanina, they could cause white piedra, and upon microscopic examination, we may also be able to observe the same structures. No? So in microscopy, we would be able to see arthroconadia, hyphae, and blastoconadia. Okay? So the arthroconadia could be seen right here, yung mga structures na nasa loob ng green na marker. The hyphae are the ones right here. So yung hyphae na intact pa. Okay? Kasi diba, arthroconadia, these are hyphae that have fragmented. Okay, so makakita din daw tayo both ng arthroconadia na and yung hyphae pa. And also, we may be able to observe blastoconadia or cells undergoing budding or binary fission. Lalong-lalo na po dito sa isang example na to within this red marker. So nakikita natin yung classic na itsura na merong mother cell, tapos attached to it is a tiny daughter cell which would eventually grow in size and break off. Okay? So, ayun po, listed here are its colony morphology, which again, hindi masyadong makakatulong sa atin, no, yung colony morphology nila in identifying this kasi, yun nga po, maraming iba't ibang maraming iba't ibang organisms or fungal organisms, no, whether it be pathogenic or not, is pwedeng maging ganito rin yung itsura nila. So, maliban sa microscopic morphology, no, nakalista rin po dito, no, yung biochemical test results na pwede nating i-observe or pwede nating i-perform. So, members of the Trichosporin Bachelii complex are non-carbohydrate fermenters. So, kahit anong carbohydrate po yung i-supplement natin sa culture media nila, they wouldn't be able to use it. They're also potassium nitrite utilizers and they are urease positive. So sa mga susunod na discussions natin, pag-uusapan po natin, no, yung urease test for fungi. Okay, so 'di ba, may ibang urease test for bacteria, may urease test din po ang mga fungal organisms. All right? So ayun po. You have to develop your skills in making correlations. So, aalamin nyo po saan ba galing yung sample. Pag nalaman nyo na kung saan galing yung sample, titignan nyo po yung microscopic morphology. So, kung nakita nyo, it has an arthrochonidia, hyphae, and blastoconidia together. Tapos, ayan, upon biochemical testing, nakita rin natin itong mga results na to. Then, we could say that the causative agent of the infection was a member of the Trichosporin Bachelii complex. Let's now proceed to the next causative agent of superficial mycosis, and it's Hortea wernicki. All right, so Hortea wernicki, this was formerly known as Phaeoanellomyces wernicki or Exophiala wernicki. So, ulit no, sa mga susunod na discussions po natin, mapapansin nyo, ang daming mga fungal organisms na na-reclassify sila sa ibang genus, napalitan yung pangalan nila, pati both yung genus and species names nila. So marami pa po tayong mapag-uusapan na organisms, no, na parang ganito. Marami silang former names or formerly known as. Alright, so again, Hortea wernicki is formerly known as Phaeoanellomyces wernicki or Exophiala wernicki. And this is the causative agent of Tinea nigra. Okay, so ayan po. Now, with regards to the clinical manifestations of Tinea nigra, we may be able to observe brown or black non-scaly macules. All right, non-scaly macules meaning there are no areas na nakikita natin would easily flake off. All right, hindi katulad ng pityriasis versicolor kung saan nakikita natin, no, may mga areas ng skin na parang nag-flake or natutuklap. Dito po, wala. The lesions or the infected areas are perfectly blended on to the skin, and we may find them at the palms of the hands or soles of the feet. Now, the problem with Tinea nigra is that this could be misdiagnosed as malignant melanoma. Alright, ulitin natin, Tinea nigra could be misdiagnosed as malignant melanoma. As we can see right here in this photo. Kasi yun nga po, no, perfectly blended siya dun sa skin nung patient. Wala tayong areas na nakikita that are kind of like flaking off or falling off from the original site. So, yun po, no, yun yung problema sa Tinea nigra. It could lead to misdiagnosis. So, mahalaga po that we first proceed to microscopic examination, no, before proceeding with treatment. Alright, so if you think it's a malignant melanoma, then mag-acquire muna ng skin biopsy. If you think it's Tinea nigra, then mag-acquire muna ng skin scrapings. Kasi syempre, di ba, magkaiba po yung treatment for those infection or for those diseases. So, iba yung treatment for malignant melanoma, iba yung treatment for Tinea nigra. Alright? Now, with regards to lab diagnosis, ang specimen of choice po ulit are skin scrapings. Alright? So, you would attempt to scrape off yung areas kung nasa nakikita natin yung black na macules or brown na macules. And then, of course, same procedure as earlier, we would kind of like expose it or place it together on a glass slide with 10 to 20% potassium hydroxide. Okay? So we should be able to observe septate hyphae, blastoconidia, and anelloconidia. So this photo right here, no, shows us a lot of blastoconidia. Okay, so ayan. Shown here are its colony morphology. So they may be brownish in color, which would eventually become olive, and then it would become greenish black, as we can see right here in this photo. kakulay ko yung background photo na ginamit ko para dito sa slide na to. Alright, let's now proceed to the causative agents of cutaneous mycosis. Let's first define what are cutaneous mycoses. Alright, so cutaneous mycosis or cutaneous fungal infections, they may otherwise be referred to as dermatophytosis. Alright, kasi po, yung mga causative agents ng cutaneous mycosis, no, they're generally referred to as dermatophytes. Okay, so ulitin po natin, yung fungal organisms that are recognized to cause cutaneous mycosis, they are referred to as dermatophytes. So the infection, no, or the term cutaneous mycosis may be interchanged with the term dermatophytosis. Okay, so these are fungal infections of the keratinized tissues of humans. Okay, so dito po, in cutaneous mycosis, this would now affect the deeper layers of the skin. So kung kanina po sa superficial, hanggang stratum corneum or hanggang sa pinaka-superficial layer lang yung growth ng organism or yung area ng infection, dito po, it could now proceed to the deeper layers of the skin. So, mula dun sa epidermis, yung 5 layers ng epidermis, papunta doon sa dermis. Alright? So, ayun po, lalong-lalo na dun sa areas where keratin is in high concentrations or in high amounts dahil ang mga dermatophytes po, no? Dermatophytes have been observed to be keratinophilic. So they like those areas. They want to grow in those areas where there is high amounts of keratin. Okay? So these dermatophytes, these fungal organisms are identified by their macroconidia and microconidia. Okay? So yung microscopic appearance po ng macro and microconidia nila, yun daw po yung nakakatulong in their identification. Listed here are other terms that we use to describe dermatophytes. So kapag po ang preferred habitat nila is the soil or outdoor environments and hindi naman talaga sila usually nagdudulot ng infections for humans, no? Dahil yun nga, mostly soil and environmental natin sila pwedeng ma-isolate, they are referred to as geophilic. Pag sinabi naman po natin na zoophilic ang isang fungal organism, ang preferred host niya are animals, okay? It's quite rare that it would cause infection to humans. So, ang mangyayari lang po, no, is if, for example, you are in close contact with this animal that has a zoophilic dermatophyte infection, then, tsaka nyo po ma-acquire yung infection or tsaka may papasa sa inyo mula dun sa animal papunta sa human yung infection. Pero again, no, if ang preferred host naman talaga ng organism are animals, they would be referred to as zoophilic. Next, kung ang fungal organism naman po, ang preferred hosts niya talaga are humans, then we would refer to them as anthropophilic. Listed here are the 3 different genera that has been notable causes of dermatophytosis. So galing sila sa Trichophyton, Microsporum, and Epidermophyton species. Now, if we were going to be specific kung nasaan mismo yung site of infection nitong mga dermatophytosis na to, magkakaiba rin po yung tawag sa mga infections na yun. Alright? So, the first word would be tinea, and the second word would be the terminology for that infected site. So, kung halimbawa, as we're seeing right here, tinea favosa and tinea capitis, these are infections of the scalp. Kapag sinabi po natin na tinea barbae, this would specifically infect the beard hairs. Kapag sinabi natin na tinea manum, this would specifically infect the hands. Kapag sinabi naman po na tinea corporis, it could be anywhere on the body, kasama na po yung upper and lower limbs. Kapag sinabing tinea cruris, this would specifically infect the groin or crotch area of the person. Kapag sinabi pong tinea pedis, no, this is an infection specifically found on the feet And kapag sinabi naman po na tinea unguium, these are infections of the nails, okay? Whether it be the nails of our hands or feet, basta kung nasaan po may kuko, yung person, that would be referred to as tinea unguium. Listed here are the different clinical manifestations of cutaneous mycosis. Now, sometimes we may be able to observe dry, scaly lesions with no inflammation. So, sinasabi po dito na pwede niyang maging kahawig yung mga superficial fungal infections, no? May scaly lesions or areas ng skin that are flaking off tapos walang inflammation kasi nasa surface level or topmost area pa yung infection. For a bit more severe infections, we may be able to observe enlarging lesions. So, lumalaki daw po yung infected site and there is inflammation. So, nagre-react na yung immune system natin or yung immune system ng patient dun sa infection. Of course, there could also be itching, ring-like patches or parang round-ish kind of like lesions. If hair shaft or hair strand yung apektado, then this could lead to brittle or broken hair. So, madali daw po na maputol yung hair strand. Now, if nails naman yung apektado, no, tinea unguium, then there could be thick, discolored nails. Alright? So, kakapal daw yung nails, tas mag-iiba yung color niya. Another term that we need to know is the term dermatophytid. So these are allergic reactions from the patient with the infection that is observed away from the initial site or initial point of infection. Alright, so kung halimbawa, ang isang pasyente na to, meron siyang tinea barbae, alright, may fungal infection yung beard hairs niya, no? Pwede rin daw po na makapag-develop siya ng allergic reaction, which is referred to as a dermatophytid, that is away from the beard area. So, maaaring may nakikita siyang allergic reactions sa hands niya or sa arms niya, which ay nga po, no, malayo dun sa original point of infection, which is the face or the beard. Okay, so again, these allergic reactions are referred to as a dermatophytid. Another specific infection or disease that we need to remember is Tinea imbricata. So Tinea imbricata, this is specifically caused by Trichophyton concentricum. Alright, so this is characterized by concentric rings of scaling tissue. So notice na yung description niya ay hindi po pasok dito sa mga usual descriptions ng cutaneous mycosis. Let's look at this photo right here. So this photo right here is an example of a person with Tinea imbricata, which again is specifically caused by Trichophyton concentricum. So as the name implies, no, may concentric patterns yung scaling or yung lesions doon sa infected site ng patient. So kapag sinabi natin concentric, yung itsura niya, parang may starting point siya sa gitna, tapos paulit-ulit yung pattern from the inside to the outside, as we can see right here in this photo. Alright? So again, no, itong description na to ay hindi very common sa iba pang mga causative agents of cutaneous mycosis. So most of the causative agents of cutaneous mycosis, ito lang yung kayang idulot. But for Trichophyton concentricum, it could cause Tinea imbricata. And ayun nga po, unique yung itsura niya because of the concentric rings of scaling tissue. Let's now talk about fungal infections involving the hair and scalp. First up is Tinea favosa or Tinea favus. Okay, so this one is a scalp infection, but the primary site of infection would be the hair follicles. So ang target daw po, no, ng Tinea favosa or Tinea favus is yung mismong area or site kung nasaan nag-start yung hair growth. Okay? So the causative agent of Tinea favosa or Tinea favus is Trichophyton schonleanii. Alright? Again, causative agent of Tinea favus, Trichophyton schonleanii. So clinical manifestations would include the overgrowth of fungal mycelia and the clumping of dead epithelial cells. So together, this would lead to the formation of crusty lesions, as we can see right here in this photo. So yung mga nakikita po natin, no, na parang naka-emboss, nakaumbok na tuldok-tuldok dun sa scalp ng patient, no, those are the lesions that have been formed. So, ang components daw po nun is yung fungal mycelia plus yung dead skin cells ng patient. Now, these lesions are referred to as scutula. Okay, scutula. So, they are crusty cup-shaped flakes that have been formed. All right. Now, if the infection is left untreated, this could lead to hair loss and scar tissue formation. All right. So, mismong yung hair follicles kasi yung tinarget at nasisira ng fungal infection. So, again, if the infection is left untreated, maaring permanente na po na, ayun, may hair loss or mapapanot yung pasyente dun sa specific site na yan. Okay. Now, laboratory diagnosis would include microscopic examination of the scutula, no? And then we should be able to observe the favic chandelier or the moose antler hyphae, as we can see right here in this photo. Okay, so ganyan daw po yung itsura ng hyphae ng Trichophyton schoenleinii. So it's Trichophyton schoenleinii that has the capability to produce the favic chandelier hyphae or the moose antler hyphae. Now, if we grow this in routine fungal culture media, we may be able to observe suede-like deeply folded colonies, as we can see right here. Side story lang po, no? This is a story from one of my grad school classes. One of my former professors, she speaks German, all right? So she's lived in Germany, she studied in Germany, and I think she has like research in Germany, and ayun nga po, marunong siyang mag-German. So sa kanya po namin nalaman that the word Schoen or Schönlein actually means lovely or beautiful or pretty in German. Okay? So, kumbaga parang dinidescribe ng mga unang scientists yung organism to be aesthetically pleasing. Alright? So, maganda daw po yung itsura, no? Parang Schönlein yung itsura ng mismong organism, which is contradicting once the person acquires the infection. Kasi, di ba, nakakapangit kapag ka may tinea favosa yung patient. Okay, so maganda lang yung itsura ng organism, no? Shown lang yung itsura ng organism, but it could make the person, ayun nga, not look very nice dahil dun sa infection. Let's proceed to other infections involving the hair and scalp. Next is Tinea capitis. So, Tinea capitis, this is also a scalp infection. Pero ang target po kasi ng mga causative agents ng Tinea capitis is yung mismong hair strand or yung hair shaft. Alright? So, kung kanina sa Tinea favosa, ang target is yung hair follicles or yung site kung saan nagsisimula yung hair growth. Dito po, sa Tinea capitis, yung mismong hair na nag-grow na yung tina-target ng organisms. Now, there are two forms of Tinea capitis. So, we have the gray patch ringworm or the black dot ringworm. Now, ang difference nila is where the fungal organism would grow. Okay? So, sa Tinea capitis, specifically gray patch ringworm, there could be an ectothrix infection. Kapag sinabing ectothrix hair involvement, only the outer portion of the hair shafts or hair strands yung may fungal growth. Let's look at this illustration right here. So, kung halimbawa po, no, ito yung hair strand ng person, yung fungal growth is itong mga parang white circles na nakikita natin sa labas. So, nasa labas lang yung fungal growth kapag ectothrix yung infection, which again, no, it happens during a gray patch ringworm infection. Listed here are the causative agents of gray patch ringworm, Microsporum arduinii and Microsporum ferruginum. Medyo mas common po na na-observe ang Microsporum arduinii. Next type of Tinea capitis is the black dot ringworm. So for the black dot ringworm, there is an endothrix hair involvement. So in endothrix, there is fungal growth within the hair shaft. Let's look at this illustration right here. Nasa looban na po ng hair strand yung fungal growth. Now, the problem with this one is since nasa loob na nga po yung fungal growth, no, ang nangyayari is the hair strands would become weak and brittle. Nagiging madupok daw po yung hair strand dahil dun sa overgrowth ng fungal organism. So this would cause the hair strands to break off and appear as black dots or black stubs. Okay, so may malilit na pieces na lang ng hair na matitira dun sa scalp ng patient na mukhang tuldok-tuldok lang na black. So kaya po tinawag yung infection as a black dot ringworm. Causative agents of the black dot ringworm would include Trichophyton tonsurens and Trichophyton violaceo. Mas commonly observed po ang Trichophyton tonsurens. So on the next slide, tingnan po natin what does Microsporum oduinii and Trichophyton tonsurens would look like upon microscopic examination. Let's first talk about Microsporum oduinii. So it has a microconidia, but its microconidia are quite rare, okay? So konti lang daw po yung pinoproduce na microconidia ng Microsporum oduinii, but they have been described to be like chlamydospores, as we can see right here in these examples. So may long area or may kung halimbawa ito yung kahabaan ng hyphae ng organism, may areas daw po, no, that there are random enlargements. Okay, so those enlargements are referred to as chlamydospores. Next, its macroconidia, no, doesn't have a specific shape, no, so they're odd shape and they have chlamydoconidia-like swellings. So let's look at this photo right here. Ayan po, di ba? Wala silang specific na shape or hugis. Hindi sila magkakamuka, no? Very random lang din yung enlargements, random lang din po yung placements ng swellings, alright? So kahawig niya rin yung microconidia, no? So chlamydospores and chlamydoconidia-like swellings. So these are the random enlargements either dun sa hyphae or dun sa macroconidia. Another notable thing about Microsporum oduinii is that this is anthropophilic, meaning ang preferred host po ng Microsporum oduinii are humans. So we would usually be able to isolate this organism only from human samples. Next is Trichophyton tonsurens. So Trichophyton tonsurens, ito naman po, it produces abundant microconidia. So madami daw po siyang mag-produce ng microconidia that are tear-shaped or balloon-shaped, as we can see right here in this photo. Now, with regards to its macroconidia, ang natatanging description lang po is that they are cylindrical, as we can see right here. So dito po, no, kapag nahihirapan tayo or wala masyadong identifying description or characteristic yung macroconidia, then we could look at other things. So, ayun po, karamihan ng microconidia na ma-observe natin from other fungal organisms, they're more round or spherical, no? So, medyo unique yung sa Trichophyton tonsurens because it is balloon-shaped. Let's now talk about fungal infections involving the nails, alright? Or yung nabanggit natin kanina, which is Tinea unguium, okay? So Tinea unguium, this could otherwise be referred to as onychomycosis. Okay, so again, isa na naman yun sa mga interchangeable na terms natin. Ulitin natin ang Tinea unguium. This could also be referred to as onychomycosis. So this one is a fungal infection of the nails, which is caused by dermatophytes. So listed here are clinical manifestations. The most common form of onychomycosis is subungual. Okay, as we can see right here in these examples. So magkakahawig lang din po, no, or same lang din yung descriptions kahit pa ibang site, yung kumbaga is parang simula ng infection. So kahit hindi subungual, lahat po sila, they would appear to be thick, discolored, and flaky. So makapal or kumakapal daw po yung nails, nagiging discolored, so nakikita natin either naninilaw or nagiging dark brown yung nails, and they would become flaky. So may mga areas din daw po nung nails, no, na parang natatanggal or natutuklap. Okay? Now, this has been mentioned in our reference book. No, ang treatment for these ones would be terbinafine or itraconazole. I think sa week 7 po ng discussion natin, mapag-uusapan natin yung different types of antifungals, pag-uusapan din po natin kung alin sa kanila yung oral, yung route of administration, or kung alin sa kanila yung topical. Kapag sinabing topical, we just apply them. They're kind of like in a cream or lotion formula. Tapos, kapag sinabing topical, no, i-apply lang siya sa surface nung infected site. Okay? But for now, ngayon po, tandaan lang muna natin, it's terbinafine and itraconazole that are usually used to treat onychomycosis. Let's proceed to Tinea pedis, all right, or fungal infection specifically involving the feet, all right? So as we can see right here, Tinea pedis, this is otherwise referred to as the athlete's foot or the moccasin foot. Okay, in Tagalog, ito po yung alam natin as alipunga. Okay, so ayan po, Tinea pedis, otherwise referred to as athlete's foot or moccasin foot, or in Filipino, alipunga. Okay, so mode of transmission would be contact with infected skin scales. Okay, so ang mode of transmission daw po nito is if, for example, a person has athlete's foot, tapos naghihiraman kayo ng sapatos or naghihiraman kayo ng tsinelas, yung pieces nung infected skin galing dun sa person na may athlete's foot, kapag daw po ito ay nadikit sa isang or sa skin nung person na wala pang athlete's foot, then they would acquire the infection. Alright? So, other possible modes of transmission may include if, for example, you all live in the same place. Alright? So, kung halimbawa, lahat kayo nakatira sa isang bahay or sa isang dorm, tas one of your family members or one of your dorm mates have athlete's foot, ayun po, yun mga nagfi-flake off na infected skin kapag po you come in contact with those, or halimbawa naglalakad kayo na nakapaa lang, no, maaari po na matransmit yung infection papunta dun sa person na wala pang athlete's foot. Alright? So, typically affected areas would be the soles of the foot, so yung ilalim ng paa, or the toe webs. Okay? Lalong-lalo na sa toe webs, dito po pinaka-readily observed yung athlete's foot. So, nakikita natin in this photo, ayun po, toe webs meaning yung pagitan ng bawat isang finger, as we can see right here in this photo. So, clinical manifestations would include scaling, fissuring, and erythema. Okay? So, scaling, so may mga natutuklap na pieces ng skin. Fissuring, so parang nagsusugat-sugat na yung ibang areas. And erythema, there is redness on the infected areas. So, listed here are the well-known causative agents of Tinea pedis. It would include Trichophyton rubrum, Trichophyton mentagrophytes, and Trichophyton tonsurans. So, kanina sa previous slide, di ba, na-describe na rin po natin yung microscopic morphology ng Trichophyton tonsurans. Next, another causative agent of Tinea pedis is Epidermophyton flocosum. So, on the next slides, tignan po natin yung microscopic morphology ng mga to. First on the list is Epidermophyton flocosum. Now, it does not produce microconidia, okay? No microconidia. Hindi daw po nagpo-produce ng microconidia ang Epidermophyton flocosum. So, if we would like to identify this organism, we would have to look for its macroconidia. So, its macroconidia is either singly or in clusters. Kapag sinabing singly, ito po yung nakikita natin dito, isang hyphae, tapos mag-isa niya lang doon. Kapag sinabing in clusters, ayan po, doon sa isang point of attachment, madami sila. They have been described to be broad and spatulate. Okay? So kapag sinabi nating spatulate, yung point of attachment or yung isang area, manipis, tapos as it moves away from the point of attachment, nagiging mas malapad yung itsura niya. As we can see right here in these examples. So ayun po, yung area na mas malapit dun sa hyphae or nakadikit dun sa hyphae, it's a bit skinnier. Tapos dun sa upper portions, no, mas lumalapad na yung itsura. Again, that's what we mean when we say broad and spatulate. And this has been described to look like a beaver's tail. Alright? As we can see right here, in this comparison. Okay, so accurate naman, no? They do in fact look like a beaver's tail. Alright, so they could contain 2 to 5 cells or 2 hanggang 5 na divisions or compartments sa loob ng isang macroconidia. So again, that's what it looks like if we're looking at epidermophyton fulcosum. Next is Microsporum canis. Now, Microsporum canis has been described to be zoophilic. Alright, so ang preferred host po ng Microsporum canis are animals. Okay? Now, its microconidia are abundant. Marami daw siyang mag-produce ng microconidia. Pero wala po kasing special descriptions or appearance yung microconidia niya. No? Another description mentioned here is that they could be maintained in cultures even after serial transfer. So, ang ibig sabihin, kung halimbawa ito yung initial source of sample mo, no, kapag nilipat mo siya from like one culture media to another, even after diluting the sample, kayang mag-produce ng abundant microconidia ang Microsporum canis. Pero yun nga po, no special description for the appearance of the microconidia of Microsporum canis. So again, ang makakatulong sa atin to identify this organism is through the appearance of its macroconidia. So its macroconidia have been described to be spindle-shaped with tapered ends. Ano pong ibig sabihin when we say spindle-shaped? Pahaba siya. Tapos kapag sinabi nating tapered ends, no, matalim or patusok, no, it has pointy ends on either side. Alright, so ulitin natin when we say spindle shape, it's kind of thin and elongated and it has tapered ends, meaning sharp or pointy po, no? Sharp or pointy yung magkabilang dulo. So, another description mentioned here is that echinolate. So, when we say echinolate, they have these kind of like rough or spiky projections on the surface of their cell. So, parang may magaspang daw po na surface yung bawat cell. Okay? And they may contain as much as 3 hanggang 15 compartments or 15 cells within one macroconidia. Okay, so again, that's for Microsporum canis. Okay, so one description that helped me remember the appearance of Microsporum canis. This is very non-scientific. Now, if you don't want to use this, you may, okay? If you don't want to use this description, okay lang. Pero kasi Microsporum canis, di ba? It reminds you of dogs or canines, di ba? And it also reminds you of the canine teeth. So yung canine teeth, or if kukunin natin yung shape ng teeth ng mga canine or mga aso, they're also very long and sharp, di ba? So ayun po, that's one of the things that helped me remember the descriptions of Microsporum canis. Una sa lahat, it's zoophilic, so it usually infects animals, which would include dogs. Next, the shape of their macroconidia kind of resembles canine teeth, which are also long and sharp. Okay, so that was for Microsporum canis. Next is Nannitzia gypsea. All right, so I've always known the name of this organism as Microsporum gypseum, but when I found out that they changed the name to Nannitzia gypsea, I never shut up about this organism. Kasi wala na, ang ganda ng pangalan niya, no? It's just because the name is pretty. Alright? So ayun po. Again, Nannitzia gypsea was formerly known as Microsporum gypseum. So this one has been described to be geophilic, meaning mas mataas yung chance na ma-isolate natin to from the soil or outdoor environmental samples. Now, its microconidia have been described to be clavate, sessile, and abundant. Again, no specific description with regards to its appearance. So, mas papansinin po natin or mas hahanapin natin yung macroconidia. So, its macroconidia have been described to be cigar-shaped with rounded ends. Okay? And they're also described as echinolate. So, kapag ulitin natin, kapag sinabi natin echinolate, they kind of have like these spiky or rough projections on the surface of the cell. So, yun yung similarity nila ng Microsporum canis. Alright? But for people who are seeing them for the first time, may mga students po na nabago lang sa microbiology na nalilito sila or nako-confuse sila na pagbabaliktad nila yung itsura ng Nannitzia gypsea versus Microsporum canis, magkahawig daw sila para dun sa ibang mga nakakakita ng pictures nila. So, paano natin ma-differentiate? Nannitzia gypsea, no? they have, yun nga, rounded ends. Okay? So, kung yung Microsporum canis, manipis and matalim yung bawat dulo niya, yung Nanetzia gypsea po, medyo mas rounded or mas blunt yung magkabilang dulo. Another thing that we need to notice is that they're a bit shorter and thicker. Okay? So, mas makapal yung itsura ng bawat cells ng Nanetzia gypsea in comparison to Microsporum canis na manipis, tas sobrang pahaba yung itsura. Okay? So, ayun po. With regards to being cigar-shaped, they kind of look like those old tobacco cigars. So, yun po. That was for Nanetzia gypsea. Again, it was formerly referred to as Microsporum gypsum. Let's now proceed to Trichophyton mentagrophytes. So Trichophyton mentagrophytes produces microconidia that are globose. So parang globe, no? Very round, very spherical yung itsura, no? And some of them may be teardrop shaped. But medyo mas common yung appearance ng pagiging globose, okay? And they have been seen, no? In grape-like clusters. Mukha daw po silang grapes, as we can see right here in this photo. So again, very accurate nga naman yung description. They do, in fact, look like tiny grapes. Okay? Next is its macroconidia. So its macroconidia have been described to be smooth with thin walls. Okay? So hindi katulad ng Microsporum canis and Microsporum gypsum, no, na equinolate yung surface nila. Ito po, ang macroconidian Trichophyton mentagrophytes, they are smooth. Okay, so walang spiky or rough projections on the surface. And they have also been described to be cigar-shaped. Another notable description for Trichophyton mentagrophytes is that they have coiled or spiral hyphae, as we can see right here in these examples. All right? Now, some people may be confused kung halimbawa walang pictures na pinapakita. Parehas kasi na cigar-shaped yung description sa Trichophyton mentagrophytes and Nanetzia gypsea. One thing that we may be able to notice is mas manipis po yung cells ng Trichophyton mentagrophytes. So they look like one of those like common yosi na nabibili sa mga sari-sari store, diba? So yun po yung itsura, no? That's the difference. No, they have both been described as cigar shape, but Nanetzia gypsea is a bit thicker, no? They look like the classic tobacco cigars. Meanwhile, yung Trichophyton mentagrophytes, although described as cigar shape, they are thinner and longer. So mukha siyang yung basic na yosi. Next is Trichophyton rubrum. So Trichophyton rubrum has been described to have clavate or peg-shaped microconidia, as we can see right here. Pero again, no, hindi masyadong notable yung itsura, hindi masyadong special yung itsura ng microconidia niya. Alright? Next, it has been described to have cylindrical pencil-shaped macroconidia. Now, out of all the things that we've described, no, yung mga nabanggit kanina na beaver's tail, spaghetti and meatballs, grape-like cluster, sa lahat ng mga describe natin ngayong araw na to, ito yung pinaka hindi accurate. So parang, who described this? Who observed this organism? And anong itsura ng pencil sa lugar nila? Because that literally does not look like a pencil to me. Alright, anyway, here's the problem. Magkahawig yung macroconidia nila ng Trichophyton mentagrophytes. Magkahawig, diba? If you rewind to the photo of Trichophyton mentagrophytes earlier, magkahawig yung itsura ng macroconidia nila. So, how would we be able to tell the difference between Trichophyton rubrum versus Trichophyton mentagrophytes? We would look at their hyphae. Okay? So, yung Trichophyton rubrum, dire-diretso lang po yung hyphae niya. But if it's Trichophyton mentagrophytes, merong coiled or spiral hyphae. Alright? So, that's how we would be able to know the difference between Trichophyton rubrum and mentagrophytes. Their macroconidia might look the same, but their hyphae is not. For Trichophyton rubrum, they have the basic straight hyphae. But for Trichophyton mentagrophytes, it has a coiled or spiral hyphae. Here are the references that were used in the making of this discussion. Malassezia fur. All right, so that's it for today's discussion. Thank you so much for listening. If you have any other questions na later on nyo na lang po maisip, no, just send them sa ating Teams chat. This has been Aurel Enriquez. Thank you so much for listening.